Hello, thank you for joining me and welcome to my presentation. My name is Stephen Shield, and in this presentation I plan to explore the issue of hospital-acquired infections, specifically those that originate in intensive care units, and the corresponding phenomenon of antibiotic resistance in these hospital-acquired infections. This issue is especially important for me because I plan to work in an intensive care unit, and I was fortunate enough to have my externship at one of our local Centera intensive care units. So I have seen the suffering and the devastation that occurs in patients that acquire hospital-acquired infections. Now, ICUs specifically account for over half of these nosocomial infections, and that seems staggering, but when I explored it a little further, it makes sense because patients in the ICU are inherently sicker. They have weakened immune systems, organ dysfunction, they may have recently had an invasive surgery, and when you combine that with the necessary mechanical equipment like ventilators, catheters, central lines, it makes sense that they could acquire infections there. Now, the alarming thing about these hospital-acquired infections is that they lead to poorer patient outcomes, they have longer stays while they're getting treatment, and they obviously have increased healthcare costs. And as nurses advocating for our patients, we want to eliminate all three of those things. And on top of that, the fact that these infections are becoming more and more resistant to more and more antibiotics is frankly scary. So in this presentation, I'm going to explore the nurse's role in preventing hospital-acquired infections, caring for patients that do have these infections, and ways to slow or even prevent antibiotic resistance. So I hope you enjoy it, and I'll see you later.